Breaking the chains, myths versus realities of mental health in a changing world. In the labyrinth of human experience, mental health remains one of the most misunderstood and stigmatized aspects of our existence. Myths about mental health, like shadows on a cave wall, distort reality and perpetuate stigma, creating barriers to understanding, compassion, and treatment. As society takes bold strides toward mental health awareness and political systems begin to reflect this shift, it's time to shine a light on these myths and uncover the truths that lie beneath. Myth 1: Mental illness affects only weak, sensitive people. Reality: mental illness does not discriminate. It can affect anyone, regardless of their strength, resilience, or sensitivity. The notion that mental illness is a sign of weakness is as outdated as believing that physical illness is a moral failing. Mental health conditions are rooted in a complex interplay of genetics, biology, environment, and life experiences. Just as a marathon runner can develop heart disease, a seemingly strong individual can experience depression or anxiety. Strength is not the absence of struggle, but the courage to seek help when needed. Today's growing mental health awareness movements challenge this myth head-on. Campaigns like Mental Health is Health emphasize that seeking help is not a sign of weakness, but an act of self-respect. Politicians and public figures sharing their mental health journeys have also begun to dismantle this misconception, showing that vulnerability is a bridge to healing, not a chasm of shame. Myth 2: Mental illness happens only in lower socioeconomic populations or certain ethnicities. Reality: mental health does not discriminate based on socioeconomic class, caste, or ethnicity. This myth perpetuates harmful stereotypes and ignores the universality of mental health struggles. While socioeconomic factors and systemic inequalities can exacerbate mental health challenges, no group is immune. Wealth does not shield someone from depression, just as poverty does not guarantee it. In fact, recent studies highlight that individuals in high-pressure environments, such as corporate executives or celebrities, are at increased risk for conditions like anxiety and burnout. This underscores the importance of access to mental health care for all populations, regardless of background. Politically, this calls for equitable mental health policies that address disparities in access to care. New laws advocating for parity in mental health insurance coverage and funding for community-based mental health programs aim to ensure that no one is left behind. Myth 3: You cannot have poor mental health if your life is good. Reality: mental health is influenced by many factors, and even those with seemingly perfect lives can struggle. Picture this: a person with a loving family, financial stability, and a dream career still feels an inexplicable heaviness in their chest or a constant sense of dread. How can this be? The truth is that mental health is not solely dictated by external circumstances. Biological predispositions, past traumas, hormonal imbalances, or even seasonal changes can trigger mental health issues. This myth silences those who feel they shouldn't be struggling because their lives appear fine on the surface. It's vital to create a culture where people feel safe to express their struggles without fear of judgment or invalidation. The rise of social media influencers speaking openly about their battles with mental health has been instrumental in normalizing these conversations. Myth 4: You are supposed to solve all your problems within your four walls. Talking to a stranger about your problems is shameful. Reality: talking to a professional can provide clarity, coping tools, and relief from emotional burdens. For centuries, many cultures have equated silence with strength and privacy with pride. This has led to generations suffering in isolation rather than seeking support. But just as we consult doctors for physical ailments, seeking help from psychiatrists or therapists for emotional challenges is not only acceptable, it's wise. Therapists provide a neutral space where individuals can unpack their thoughts without fear of judgment or bias. This practice has gained traction in recent years as therapy apps and telehealth services make mental health support more accessible than ever before. Political initiatives promoting mental health hotlines and affordable therapy options further reinforce the idea that no one should have to face their struggles alone. Myth 5: Therapy is needed only when you are in crisis. Reality: therapy can be beneficial for anyone dealing with stressors or seeking personal growth. Therapy isn't just a fire extinguisher for emotional emergencies, it's also a compass for navigating life's complexities. Whether you're dealing with career stress, relationship issues, or simply striving for self-improvement, therapy offers tools to enhance your well-being. This shift in perspective has given rise to preventive therapy, a proactive approach to maintaining mental health before reaching a breaking point. Mental health awareness campaigns now emphasize therapy as an act of self-care rather than crisis management. Myth 6: Mental health treatment is lifelong. I am too old for this. Reality: treatment plans vary and can be tailored to address short-term stressors or specific goals. The belief that seeking help locks you into a lifetime commitment discourages many from taking the first step. In reality, therapy and treatment plans are highly individualized. Some people may benefit from a few sessions to address a particular issue, while others may engage in ongoing therapy for deeper exploration and healing. Additionally, age is no barrier to mental health care. Whether you're 16 or 60, it's never too late to address unresolved issues or improve your quality of life. As governments push for expanded access to mental health care for seniors and veterans, we are reminded that healing has no expiration date. Myth 7: Psychiatric medications are all bad, have too many side effects, and lead to dependency. Reality: medications can be effective when prescribed appropriately and monitored closely by professionals. The stigma surrounding psychiatric medications often stems from misinformation and fear. While it's true that finding the right medication and dosage can take time, these treatments have transformed countless lives when used correctly. Psychiatric medications are not one-size-fits-all solutions, but tools that can support therapy and other interventions in managing conditions like depression, anxiety, and bipolar disorder. New laws in many countries now require clearer labeling and better patient education about psychiatric medications, empowering individuals to make informed decisions about their treatment options. How these myths impact society today. These myths don't just harm individuals, they ripple out into society as a whole. Stigma prevents people from seeking help, leading to untreated conditions that affect families, workplaces, and communities. Misconceptions about mental health also influence policy decisions, often leaving mental health care underfunded and undervalued. However, there is hope on the horizon. The global conversation around mental health has gained unprecedented momentum in recent years. Initiatives like World Mental Health Day and legislative changes aimed at prioritizing mental health parity reflect this shift. Governments are beginning to recognize that investing in mental health care yields long-term benefits for public health, economic productivity, and social cohesion. A call to action: breaking the silence. The myths surrounding mental health are like chains, binding us to ignorance and fear. But chains can be broken with knowledge, empathy, and action. As individuals, we can challenge stigma by educating ourselves and others about the realities of mental health. As a society, we must advocate for policies that prioritize accessible and equitable mental health care for all. Let us remember, acknowledging our struggles is not a sign of weakness, but an act of courage. Seeking help is not an admission of failure, but a declaration of hope. In this era of growing awareness and political change, we have an opportunity, and a responsibility, to rewrite the narrative around mental health. Together, we can create a world where everyone feels seen, supported, and empowered to thrive. The mind is its own place, wrote John Milton in Paradise Lost. Let us ensure that this place is one of understanding and compassion, not myths and misconceptions.